I'll just tell Margaret now there's 2 paths.
Excellent. I'm just going to step away for a sec. I'll be back in 3 minutes.
Okay.
Okay.
Hi, Audra.
Hello.
So far, so good. We can hear you. I see your name. How are you doing?
Good, thanks. Okay.
Hello? I guess I should speak or say something so that you guys know you're logging into the right thing. Welcome. Hello?
Hello?
Hi, Nancy. You're working. You good?
Okay, I'm completely confused how this is working, so
no
I'm on
problem.
the phone.
If you could, in order to call through on the phone, because there's a little bit of a different setup, you can disconnect your audio from here and then just call into the conference ID that's listed down here at the bottom of the screen. So on your telephone, it would be 2 separate things. You would still see all of this on your computer screen, but then you would just use your telephone to phone in through the audio like you would a normal teleconference.
Okay, so it didn't work on my computer, so...
No, it won't, and that's fine. If the audio is not working on your computer, your best bet is to just phone in through the telephone.
Okay.
Yeah, that's what the MFRC PEI that we're using their license, that's what they've requested we do if you're going to use the phone.
Okay.
So just hang up your phone part and stay connected.
I wanted to use the computer, but obviously I need a lesson. I'll just hang up and do this number.
If you can. Can you see the computer screen at all?
Yep, I see the lead page, mental health performance measures webinar.
Perfect.
Okay,
So
I'll
you
hang
can
up and
stay
then
on
do
that screen and just hang up your audio. And then just, so you can still stay on the screen and see the computer screen, you would just click on the audio button over here and disconnect your audio, and then call in on the telephone.
Okay, all right, thanks. Okay, bye.
No problem. Bye.
Hello?
Hello?
Hi.
Hi.
I dialed in, and I don't know if I'm dialed in right. I can't do the registration ID and session password is not working to join.
Okay. Can you see the screen, the mental health performance slide that's on the screen?
No. I'm just,
No.
I clicked to join, and it's asking for join session now on the right-hand side, and it's asking for a registration and session password.
Oh, okay. Probably when you go, if you try it again, there's, on the website, there's a link that says either register. If you haven't registered yet, it says register. If you have registered, it says join. You might just need to register. It's just a quick click, and you'll fill in your name.
I did register before, and
so did you receive an email based on whatever email address you put in there? You would have received an email confirming your registration, and that provides a link on how to get in.
No, I haven't received any email.
Okay.
Is that Jacqueline?
Pardon?
Is it Jacqueline speaking?
Yes, this is Jacqueline speaking. Hi.
Okay, so hi, this is Gada. So you were able to log in.
I was able to register, and then it gave me a code, like a code and a phone number. So I just dialed in on the phone.
That's with the new link I just sent you, right?
I'm opening that email now, so just. Like the website pops up, and I did the register, and then, but I haven't gotten an email. I have join and register both in the same.
If you can click, you can click join, and that should take you right into joining.
Yes, but then it's asking for a registration ID and password.
Okay, then click on the register, and maybe it's just going to ask you to put your name in and email address again instead of join.
Okay.
So.
And what we can do, Stacy, just I want to make sure that we're, I'd like to start pretty soon.
Yeah.
So what we can do for additional people, if they're having trouble signing on, I'll not only upload this presentation to the website, but I'll send it around via email after the fact.
Okay.
So if they're having trouble with audio, they can always dial into the teleconference number, or if they're able to hear the WebEx audio, they can listen in.
Okay, perfect. And yeah, I can also attach this recording as well after the fact. So.
Great.
Yeah, it's saying that I'm already registered, so if I can just stay on the phone, then that'll be fine.
If that's the case, if you could call into the 800 number. Did you receive? It's 1-877.
1877.
Yeah. 413.
413.
4790.
4790.
And then the conference ID that you'll need when you get there is 887.
Okay.
2823.
2823.
Yeah, and that'll connect you via the teleconference with Jonathan.
Okay, perfect. Thank you.
No problem. Thanks.
Bye.
Bye.
Okay, well, I think we'll get started. I know a few people are signing on in that, but we're also recording this session, just so that you know. And that's for the folks who weren't able to join us today who might want to watch it after the fact. and also so that we have it down on the website as historical record in terms of the information that we pass along and some of the good questions that you guys likely have. So I'm just going to, my name...
What website?
The Performance Measures website. I'll send you the link after the fact if you're only on the phone. If you're on the screen on the WebEx, then I'll take you through how to get to the website. Okay? So I'm Jonathan from Military Family Services. I'm the lead on Performance Measures. And you might have seen me before, heard me before, or seen one of my many emails. I think I've sent at least 5 separate emails over the months to the various EDs across the country about performance measures and the updates to the website that we're going to be going through in a minute. But just before we get to that, I'd like to welcome you all and just go through a bit of a roll call just to see who we have on the line here on the teleconference line as well as the WebEx. So I'm just going to run through. It looks like I've already asked a number of you, and I've checked the list on the side here, and it looks like we've got Aaron from Comox. Do we have Angela Nicholson from Kingston? Okay. And how about Anne-Marie Vaillancourt? Est-ce que vous êtes là? Okay, so she wasn't able to join us. I'm just going through the list of people who registered for the WebEx today. We have Audra from Calgary signed in. We have Kathy from Comox, Claudia Beswick from Petawawa. Are you on the line?
I'm here.
Okay, excellent. Welcome.
Thank you.
And Colleen from Kingston. Okay. And Heather from Calgary. Don't hear a yes. I think I saw you on the right-hand side. Okay, and we've got Sherry Pierce. Great. Thank you very much for that chat. By the way, if you're having trouble with your audio, you can also use the chat on the right-hand side at the bottom of the WebEx. And next we have Jasmine from Comox. You've already let us know you're here. Louise Cameron from NCR.
I think she's in another meeting that she's trying to get to this, but
okay.
She's in a meeting right now. Sorry about that, Jonathan.
Sure, no problem. Who's that speaking?
It's Ruth.
Oh, great. Okay. So Ruth, you're from the NCR.
Yes.
Excellent. Yes. Fantastic. Well, thanks for joining us.
Thank you.
And we've got Nancy from mainland BC. You're signed in. Priscilla from Esquimalt. Regan from Moose Jaw. Are you there? Okay. And this is exactly why we're recording, just because we realize that things come up and sometimes you're not able to join us on the day of. We've got Ruth from NCR. How about Ryan from Shiloh? No. And we had a few others. Sandra Garland. Okay.
Yes, I'm here.
Yeah, okay, excellent. Whereabouts are you from, Sandra?
St. John's, Newfoundland.
St. John's, great. Thanks very much for joining us. And we've got Sherry Pierce and then Sylvie Gagnon. Est-ce que vous êtes là?
Avec Anne-Marie Vaillancourt.
Ok, super. Merci. And we have Francine Abel.
Oui.
Yeah, okay, perfect. And Isabel on the line from Family Information Line.
Yeah, hello.
Great to have you, Isabel. And Kara from Halifax.
Hello.
Excellent. All the way from Halifax. Great. And we've got Noah, I think, signed in. Is that correct?
Yep, I'm there. I'm here.
Great. Whereabouts are you from? Sorry, Noah?
I am in Yellowknife.
Yellowknife. Okay. Great. And Teresa Welch from...
we're here.
Great. And whereabouts are you from, Teresa?
Teresa and Caitlin are from the Borden Family Resource Center.
Okay, great. So we've got representation across the country. Did I miss anyone?
Jonathan, can I just interrupt for a second?
Sure.
Since you have the ball, would you mind going up to the participant tab and assigning privileges and assigning them the chat privilege? Because right now the chat can only go to you and I.
Okay.
If you could do that quickly so that they can chat to everybody if they would like.
Yeah, you should all have all privileges now at this point.
You also have Jacqueline Hunter and Tracy Mulligan from Trenton.
Okay. Great. Super. Thanks for joining us today. All right, so we'll get started, and people may join along the way, which is totally fine as well. Like I said at the beginning here, I'm going to not only upload this presentation to the website that I'm going to show you in a minute, but also send it around to participants in an attachment, just in case that's useful for you guys to have a look at. So hopefully some of you have joined us on the various teleconferences and video conferences that we've had around service delivery. Actually, just to do a quick poll, I think a number of you have probably used WebEx. Can you give me a green check if you've used WebEx before, just to see how many people on the line have used it? Okay, great. So you can see on the right-hand side quite a few people have used.
I can't see that. Nancy.
Yep, excellent. So yeah, that's excellent. So a lot of you have used WebEx before, and some of you are more comfortable in the teleconference. That's why we offer both options here. This is basically just a quick check-in to give you an overview of what's available on the MFS Performance Measurement website, and to answer any questions that you might have about the mental health performance measures in particular. And whatever I'm not able to answer today, I'll go and seek out the answer and bring it back to you guys and make sure that everyone gets the same communication. Like I said at the beginning, we're recording this just so that those people who can't join us today will be able to take advantage of some of the learnings here, as well as some of the questions that you might be bringing up. So what I'm going to do right now, actually, is I put it right into the presentation, a screenshot of what the MFS website looks like at the bottom of the page. But and you can see the website address down there at the bottom. What I'm actually going to try to do here is share my Google Chrome page. We'll see if this works. And then go directly to the CFMWS site. So just to walk you guys through, in case you've never been to the performance measurement website before, so you click on MFS at the bottom of CFMWS. You can see the address up here in the top left-hand corner. If you scroll down to the bottom of that page, there's a quick link to the working groups. Okay, so you just click on that, and then under working groups, you have all the various working groups that we're offering in Military Family Services. At the very bottom on the left, you have the Performance Measurement Tiger Teams, which is the website that I'll be talking about today. So that's how you basically, you can see you go from CFMWS, the site that I'm sure you all know about, to Military Family Services, working groups, and then performance measurement. So I'm just going to go back to the presentation here. And you can see I took a screenshot just of the website, the performance measurement website, and basically what it looks like. So it gives you, the reason why I wanted to share that with you is because this gives you, we set it up to give you as much information as possible about performance measures, service delivery, any kind of questions that you might have. So we've got not only the PowerPoint presentation that I held last April, where we had 24 of the MFRCs join us, on the MFRC service delivery data. So we've got not only the PowerPoint presentation, but actually the video of the session down at the bottom there of the website. It's labeled Guidance on MFRC Service Delivery Data, because that's what the webinar was called. We've also got a checklist for performance measures, a glossary, so if you want to know about the lingo that we're using in performance measures, sometimes it was tricky to keep it straight between all the staff that were working on this, so we wanted to make sure that we had a standard lexicon that we were using. Frequently asked questions, which I've updated a number of times based on your really good questions from the field, so be sure to check that out on the website as well. And flow charts that was asked for by one of the MFRCs of what is the process of service delivery, offering service delivery data from the MFRCs to MFS. So I created a little flow chart on that. as well as some sample forms for MFRCs for tracking their statistics. So these, the sample forms at the bottom of the website are simply examples. They're definitely not something that you need to use. We just wanted to put up a few examples of what some MFRCs are using in case they might be of use to you. Okay, so actually, just in order to get feedback from you guys again, can you give me a green check mark if you have accessed this website at some point, this performance measurement website? Okay, excellent. So quite a few of you have, which is great. Good to see. Okay, so now just before we get to your questions, I just wanted to go over, I'm not going to go into detail about the background behind the performance measures, but I did want to give you a really brief overview in about 3 minutes of how we got here in terms of performance measures. So basically, you can see from the slide that it started with the Ombudsman's report in 2013, which indicated there was a real need for systematic and systemic performance measures for military family services on a recurring basis. So they really reinforced that, which then in the operating plan, the MFS operating plan in 2014, we incorporated those recommendations directly into the operating plan. So the operating plan pledges that we'll develop and use performance measures to show tangible evidence of our investment in military families. Now, the first step in developing performance measures was figuring out what is the impact that we're seeking to achieve in military family services. So what are the outcomes? And a basic way of showing outcomes is called a logic model. It shows short, medium, and long-term outcomes. So we developed the logic model in 2014, and that was developed in consultation with over 100 participants, including teleconferences with 81 participants from 27 locations across Canada, the US, and Europe. So that included board members, MFRC staff members, as well as military chain of command in that consultation. Then from that logic model, we were able to start looking at how are we going to measure these impacts? How are we going to tell if we're making a difference? And so that was first developed through a literature review of standard indicators used in the government and in the family service industry, and in consultation with a number of subject matter experts. But where the rubber really hit the road on this, on the performance measures, was with the Tiger team. And that was made up of 10 MFRCs across the country, and there were a series of teleconferences and video conferences with not only the Tiger team, but following that, 24 of the MFRCs, with a total of 34 participants among them. I spoke with them all during this video conference that I described on the website. About service delivery, what the plan was, what the measures are, and the fact that this was a trial year, 2015-2016, to see how effective these measures are, how useful they are, and also how consistent we can be in terms of, or you can be in gathering them from the field, so how easy that is. And then based on the feedback from the field, as well as usability on our end, we might tweak them in April of this year. So finally, we get down to the bottom, MFRC service delivery data in 2015, and basically the goal was we only want to ask you for information that we absolutely need. So we really seriously streamlined the amount of data we were asking from the MFRCs, because a lot of the MFRCs, you were telling us that we spend many, many hours not only putting together these numbers, but then inputting them into e-business. So we did away with e-business, went to fluid surveys, which hopefully is a lot more user-friendly, and we cut down the number of questions from 1,500 questions to just over 50 questions. So hopefully that's a little less a burden of effort on your part, and we're asking only the stuff that we actually need. Okay, so in terms of the discussion, you guys have probably seen, I've pasted up on the screen here the annual service delivery data sheets that you guys have likely seen. These are available on the website as well, the English and the French versions. And that provides you with not only the questions that we're going to be asking on the fluid surveys, but also the guidance documents on, wrong way around. But you can see the guidance, there's guidance on each specific question, so how you calculate it and those kinds of things. So it's probably easier to actually view on your own computer if you download it, and you've likely received it by email from me as well. So one of the questions that came up, which I wanted to start off with because we already received it and I wanted to address it here, is with regard to mental health services and how do you preserve the confidentiality of the family members coming in if we want to gather stats on how many mental health services you guys are offering. So that's a really good question, and what I usually tell people is that two key things are keep it simple and don't reinvent the wheel. So what I mean by don't reinvent the wheel is if you have something that works for gathering stats, mental health stats, in terms of some MFRCs have a database they work with, or some others have a computer system, computer program, then feel free to use that if that works for you. But if you don't, then keep it simple. Don't try to develop a whole complex database that's going to be a nightmare to maintain. Some MFRCs, in the endeavor to keep it simple, have done something like they take a copy of the nominal roll, the most recent nominal roll, they pass it around among staff, and then each staff member puts a check next to the name of any individual who's received service from them in the past fiscal year. And that way, you're not identifying that this particular family has used mental health services. You're just identifying this family has used MFRC services at some point during the fiscal year. And they just pass it around, and whatever names that person has encountered during the year that aren't already checked, they put a check next to them, and that gives them a rough idea of the family members or the families that they've served. So I wanted to start off with that, but now I'll open the floor to questions. We're at 1:23, so we've got quite a bit of time for questions. So why don't we, in order to try to keep this somewhat organized, why don't you put up, do you know how to put up your hand? So there's a little hand signal. Yeah, there, Stacy has put the yellow arrow next to the hand signal. Now you just click on that, and that shows that you want to ask a question. And then
Jonathan, from Trenton, we can't actually get in to put up our hand.
Okay, perfect. So why don't we start with the folks on the teleconference, and then we'll move on to the WebEx, and in the order that you click on the hand signal, and then we'll just go through a roll call to make sure that we haven't missed anyone. So Trenton, why don't you start?
Well, one of the things for that keep it simple is writing down the names for every client.
Yeah.
That is still breaking confidentiality, even if we don't write what service you're taking, especially with, I'm with the CanSoft comm unit.
Right.
So doing that is not going to be successful, and it's not going to happen.
Okay. Okay. So what have you've probably had discussions amongst the staff, the mental health service staff in particular. Have you come up with any ideas as to how, in your particular unit, how you'd like to work it?
We have a database that we use that we can get numbers from. The problem isn't us getting like our individual unique families, it's comparing our unique families to the rest of the services in the MFRC. So how do I know that the Smith that I'm seeing for counseling is the Smith that our employment and education person is seeing?
Right. Yeah. So the so you want to gather. So your database will help you to gather the mental health stats.
Yes. Yes.
Right. And then for the now that database, is it only for mental health stats, or is it for other things as well in the MFRC?
Right now, it's only for mental health stats.
Okay. Okay. So in terms of the other non-mental health related services, what you can do is simply develop a list, whether or not it's the nominal role. And this is just, I mean, part of the idea of this session is to spitball ideas, right? Because not every single idea is going to work with every individual MFRC, and certainly CanSoftCom is a bit of a unique situation that you've got, is develop a list specifically for individuals outside of mental health services. And then the staff members, and by keeping the list within the staff member population, or you can have particular teams within the staff member population if you really want to restrict the number of people who see this list, and then they have a look at that list together and check off the people who have received education or employment services. Would that work?
We would have to have the other services give to the mental health, and they would no longer be a part of it because we can't even say, yes, we know this individual.
Right. Yeah. Yeah. So they would have to check it off first and then give it to you.
Okay.
Yeah. Would that work?
In theory, yes. In theory, yes, but
yep.
I don't know how our fellow staff members would feel about it being so one-sided.
Right. Yeah. 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 And yeah, I mean, it's a good point. On the other hand, I think most people will understand that mental health services is a particular thing. There's been so much work over the last few decades by you folks and by everyone in the mental health field. I'm a social worker by training, that to try to destigmatize the access to mental health services while maintaining confidentiality and anonymity. So I think people, once you explain that to them, hopefully they'll understand that mental health services is a very unique animal, that we need to make sure that we're maintaining confidentiality around those kinds of services. So that's why the flow of information, while it's one-sided, that's actually helping to achieve our objectives for military families in total.
But even strategy on how to present that, I would be more than willing to listen because we've tried. And
okay. Okay. And what I can do is I'm happy to attend a separate teleconference with you and your staff to go over questions that they might have and just to chat about it, so that we can have the time that's needed in order for them to feel comfortable that, okay, this is probably the best way to go about things. So if you want, after, we can if you can send me an email, I'll write down my email on the page here.
We can't see the page, so.
Oh, right. So just look up Jonathan Pratt, P-R-A-T-T, on the D1. And I'll also make sure that my email is sent to all the participants here.
Perfect. Thank you.
Yep. Sorry, there was someone trying to talk there?
Well, Jonathan, outside of mental health services, I don't even know if we've not asked permission from our family members to use the information like that. That's one issue. So absolutely, yes, mental health services, you know, that in particular confidentiality, but we gather information on families and different programs, and unless we've let them know that we're going to be doing something different than what we've collected it for, that's a privacy issue. And the other reality that we've talked about at the Tiger team and continues is there is no way at the Halifax site that I can tell you how many people in our daycare, casual care, mental health, deployment services, we are in the hundreds. I can't, even if I had permission from all people, there's no way I could, we don't have nominal, like we couldn't, nominal roles are not what we operate in. That's not possible. Even if we had them, they wouldn't be useful. And so there is no way for us to give you, this is how many families use the Halifax site and be able to tell you that they're unique ones, because of the amount of people that we serve. To be able to have staff members cross-reference and see who's used different services, that's not going to be happening. So you will be receiving our numbers according to, as unique as we can to specific programs, like a casual care program, we keep unique to that. Our PSIs have a non-identifying way of collecting their information. We can give information to that, but they will not be able to be cross-referenced in any shape or form.
Right, because you'll have duplication across programs and services.
For sure, and the numbers we're talking about, it would be, we don't have one database that would collect that and cross-references, and we've not asked permission from our military families in order to use their information in an identifying way, because you really are identifying them if you're starting to check off across programs and see that they use, even outside of mental health services, that they used casual care and they used our daycare and they used the deployment service and they used employment. That's a different level that you're using information that people need to give you permission for.
Yeah, and that's why I think some of the MFRCs have broken it down into teams, so their child care team goes through one list and enters the info in a database, or provides the info to the basic statistic, the person who's responsible for all the stats, just to try to keep that information in as small a group as possible.
Yeah.
In terms of, absolutely, there will be some issues in terms of duplication of numbers. And that's why, and it's different depending on the system that you have, the size of the MFRC, how up to date your nominal roles are, all that kind of stuff, which is why we try to provide as broad a question as possible, but then provide a dialog box under each one. And that way you can specify, if for instance in Halifax, you've got specific numbers for specific programs, then you can put those in that dialog box and just mention, the overall number will not be accurate because of duplication and because of the way that we gather the stats and the size of our population.
Absolutely. Yep, that makes sense. We'll be transparent in what numbers we give you and how we got them. Yep, that sounds good, Jonathan.
Exactly, yep. And that way, and this will be a learning year for us, so if we encounter that problem a lot, then we're going to have to re-look at how exactly we can gather that stat more accurately.
Okay, thanks.
Yep.
Jonathan, it's Nancy in mainland BC.
Sure, yep.
We too can't do names.
Yep.
I think we can all agree that that's not going to happen. So
yep.
Whether we have a code, number, a scramble, yeah, I mean, that's something we could do. And again, I'm sort of coming in blind because I've not seen any of these forms and
right.
nothing like that. So
yep.
Maybe I can talk to someone on another call about where to actually take a look at some of this.
Absolutely, yeah, and
again,
I'm happy to.
Roles, sorry, we've got 14 reserve units, so the idea of nominal roles, that's not going to happen out here. Say we can't find another way. But cross-referencing, I don't know if I mean for us, and I guess we're just talking about mental health here.
Yeah.
I mean we're a separate entity that's the stats, providing it's just numbers and not assigning anything else with it.
Yeah.
That I would be okay with.
Okay. Yeah, and that works for some people as well, is assigning numbers, which we've done in certain cases. In other issues is assign a code. It really, and that's why I said try to keep it simple, but make it work for you at your individual location, because not every location is going to have the same size or the same type of population. Like you said, you've got a huge number of reserve units you're dealing with, which is a very different kind of population to serve and information to gather than some of the other units.
Okay, thanks.
Yeah. And I'm happy, by the way, to chat on another call about any particular issues that you're having around the stats, or if you want me to walk through some of the resources in that.
Thank you.
Okay. So let's have a look at the WebEx here and see if anyone's put up their hand. Okay, great. So we've got Nancy with her hand up.
That's just because I don't know how to work anything.
Yeah, no problem. Well, clearly you know how to work the hand signal, so that's great. So are there any? It doesn't look like anyone else on the WebEx has put up their hand.
Hi.
Anyone on the?
Jonathan?
Yep.
Hi, it's Jasmine from Comox.
Hi, Jasmine.
Hi, how are you?
Good.
I just have a question, because we've been keeping our stats, like we've been doing numbers, but we're keeping it monthly, and so is that not the information you're looking for? Are you just looking for how many unique family members have accessed their service in the entire year, like in the fiscal year? Is that
The reason why we did, yes, we're looking for the entire fiscal year. And the reason why we did that is we talked about that a lot in the Tiger team among the MFRCs, and going from month to month, because there's such a huge fluctuation between posting season and then you've got summer and then a whole bunch of people coming in the fall, it fluctuates so much on a monthly basis that it would be very difficult to get accurate stats on a month-to-month basis. And in addition, you've got some people who are being served in April who will also be served in May and June. So it's just a little bit easier to gather the information by fiscal year. Now, having said that, it's up to the MFRCs how they want to gather it. Some of them have chosen to gather stats on a weekly or bi-weekly basis. Some of them do it on a monthly basis, like yourself, and some of them wait to do it on a quarterly basis. So it really, it's whatever works for you and your staff.
Okay, but sorry, I'm still not clear. So the information you want is to say, like, Joe Smith has come here this year. You don't need to know that they came 2 times in April, 5 times in May. That's not the information that you're looking for? Okay.
That's right. And so we've got 2 separate questions on there. You'll notice that the first question, and I'm talking about the form here as well as the fluid surveys. So you've got the first question about family contacts and the second question about family members. So family contacts, that deals with how much, what's the burden of effort for you in terms of how much time have you actually spent serving these people. So that gives us an idea of the workload for you guys in terms of family contacts. So that's where it would be represented that, for instance, Jonathan Pratt received 5 different services, 3 times during the year. And so you'd be able to reflect all those individual contacts there. As the second question is specifically about family members, so whether or not they've been served 5 times or once.
Okay, perfect. Thank you.
You're welcome. Any other questions on the phone before we skip back to the WebEx participants? Okay, let's see if we have any hands up here. Louise Cameron.
Hi, Jonathan. It's Ruth Stanley Aikens. Louise and I are sitting together watching you on our screen, so thank you for having us.
Yeah.
You and I have talked a little bit about the difficulty, and I think we've gone around and around about confidentiality and that sort of thing. I just want to say that coming from really 35 years with the federal government at a whole bunch of different levels, monthly recording is kind of the norm, but also non-identifying monthly reporting is what we can do, and everyone's in agreement with that from the sounds of it. Again, just want to say I have 11,000 members rostered. I cannot pass around a nominal roll for other confidentiality reasons, but I also think that if in the years to come, if we had a system that collected that was universal across the country, we wouldn't actually be having these kinds of conversations because we could really manipulate the information. I mean, short of the joking that went on earlier this week at the other working group that happened, we can't give them user cards, we can't chip them. It's just, you really are not going to get the stats you're looking for from us just because of all of the same rationale that everybody else had in terms of multiple points of service access and the inability to share that information.
Yeah, absolutely. And that really would be, I mean, I know you were joking about it, but that would be ideal if for instance, everybody had a CF1 card and we could actually have a scanner at each service location. But that's pretty pie in the sky at this point, I think. Yeah, so we're trying to, as much as possible, make do with the information that we have. In terms of developing a system to collect the info, we've looked at that, and we'll continue to look at it and entertain any kind of ideas that you might have from the field or here at headquarters that they might have. My personal experience with systems is they become a monster in themselves because people end up spending hours trying to troubleshoot their way through the system, just like e-business and whatnot. So sometimes, I mean, in this particular case, it would be, if we could enter everybody's info, it would be ideal to have that information. But the amount of human hours that it would take to, first of all, develop that system, but also maintain it and enter the data, I'd just be so worried that we grind operations to a halt in the effort to create an accurate database. So that's been my kind of reluctance to go for a complex system, and that's the context around why I say try to keep it simple.
Sure, and I'm not suggesting anything like that, but even an appointment system can gather your information the way you want it, but we're a long way from that.
Yeah.
The other thing I just wanted to say was, essentially we will continue to gather the stats and do the best I can, but we will have tons of duplication because I can't tell you if Joseph logins is Corporal John Smith's son. I can't tell you those things from community integration or employment or education.
Absolutely, yeah. Which is really why we. I mean that in particular, that example is why we went with family members, because previously we were asking for a number of families, but then a number of the MFRCs and the Tiger Team participants were saying, well, how can I tell if this Joey here belongs to the same family? Like, how do I know I'm not counting them twice and stuff? So then we said, okay, how about family members? That way each individual is treated separately and you don't have to worry about whether or not they're from the same family. But any way you slice or dice this info, we're always going to have that gray area there, and also some of the inaccuracies. So if as you're gathering the info, if you notice that the way that it's gathered, we're going to have a lot of duplication in this category, just note it in the dialog box, because that's really important info for us to have in order to continue to develop these. Because if all the data that we're getting is just completely inaccurate, then we're going to have to rethink the way that we're asking the question and gathering the data.
Okay, thank you very much.
Yeah, you're welcome. Okay, let's see if we have any other hands up here. Okay, great. So Claudia.
Yeah, Jonathan, we're kind of in the same boat as Halifax with our numbers and the added challenge of our infrastructure with having 10 separate locations. We have too many entry points to be able to track a unique family. Yeah. So can we, if we collect stats by our program group, would that be possible?
Staff by program group, or you mean
like
family?
Stats, community development stats, and mental health stats?
Yeah, and as much as possible, I mean, the number of family members served, the second question there, we know that, and that's why I actually put as closely as possible, because I know that that's going to be it's going to be difficult for you guys to get accurate numbers around that. And frankly, we may need to drop that question in the future, just depending on how accurate the info that we get. Because even from our local CF stats, they're not always accurate. They're only accurate on the particular point in time that we ask for the info, and that's changing all the time, as you know. So just do your best in terms of, if you want to do it by program and add up those numbers, just make sure you noted in the dialog box how you calculated that, and because that might give us some clues on how we can improve that particular question.
Okay. Thank you.
Yeah. And also, if you do it by program, that should help you with, in terms of question number 1, the total family contacts. That way, with your 10 different locations, you can look at each contact with a family at those various locations and just add them up.
Okay, perfect.
Yeah. Okay, so I think we had a third question here. Priscilla.
Hi, Jonathan. Actually, it's Gaynor along with Priscilla here.
Okay, great.
Quick question for you. I think we can definitely give you the, as closely as possible, the intervention numbers that you're wanting.
Yeah.
Which is fine. Again, as a large base, it's really hard to look at all the points of entry. Sure. Also, we don't get nominal roles, so not every base gets nominal roles, and actually 70 nominal roles attached to our base, so it's kind of cumbersome. Yeah. My question, however, is, you know, numbers are numbers, and can serve 100 people and probably not have the outcome that you want or what's intending, like going back to your logic model. So is there a movement in the future to actually look towards more outcomes? Are we actually achieving what we want to achieve by just gathering numbers? Because numbers can look great.
Absolutely, yeah.
The day achieving the goals?
Yeah, and that's why you'll notice that with the stats that we're asking, and also if you, okay, so let me start at the beginning here. On the website, you'll see the presentation from last April in which I go through how the numbers are going to be displayed in terms of the dashboard and whatnot as a quick reference for what we consider to be the most important stats or stakeholders that we're speaking to would be most interested in. Some of them are outputs, so just showing how busy we are, how much work is being done. Some of them are related to access and awareness, so that has to do with certain outcomes around increasing awareness among family members that these services exist, and also improving access to family members. But the last one that I think you're probably getting at is more the outcomes, the impact, the long-term impact. Are we actually making families more resilient? Are families feeling more connected to their community? These kinds of things that we're actually going for in the long run. In order to get that data, we have to have a large enough sample size. We can't just ask, 5 or 10 families, as you know, and it's a bit of a nightmare, to be frank, because families already feel pretty over-surveyed. So what we decided to go with is we said, okay, let's try to keep it simple, figure out what data we've got right now. And what we've got right now is the Quality of Life Survey, which is administered by the DGMPRA, Director General Military Personnel Research and Analysis. They administer that once every 3 years. They get about 5 to 10,000 respondents, usually per survey, and that's where they start asking the questions around resiliency and how much impact military family services have had, and what particular family services have had an impact for them, and would they go back to those services. So really getting at the impact of those. So we're working closely, just so that you know, with the Quality of Life Survey folks. I've been working with them for a few years now, just making sure that the next time the survey comes out, we have some additional questions in there to answer some of those impact statements. So that's a long way of saying, yes, we have some indicators that are outputs showing how busy we are. We have other indicators that are more outcome related, but they, unfortunately, they're not terribly responsive because we're only going to be able to get them once every 3 years or so with the Quality of Life Survey.
I'm just wondering then if there's a way to keep it really simplistic at our end. So what we want to do, obviously, is provide you the data as to our, I see the big picture with the big surveys, are your needs being met? But locally, so, for example, if we're giving you stats of, say, 50 folks have received intervention services, what is the outcomes for those 50 folks that we provide to you? And so are there processes that we can use? And I would say that there are. It's really about us, measuring with our participants, have their goals been met, and getting their permission perhaps to check back in with them in a year or 6 months just to see if it's had an impact on their lives. And these are the types of things that we can be gathering at our end that can actually then inform you for your measurements in the future. So, I think those types of ideas and supports for those of us on the front line would probably be useful as we move forward, because I just get concerned the more we just push out numbers. It's real easy for me to say, 75, 80, 100. At the end of the day, though, you don't know exactly what we're doing down here, and I think that's the shift that we probably want to make as we grow and modernize ourselves.
Yeah, absolutely, and that's a really good point. What you're kind of indicating there as well is that it's not just about numbers, because the Ombudsman actually said specifically they would suggest that military family services incorporate performance measures, quantitative and qualitative. And so it's not just about the numbers, even if it is a number related to impact in terms of the number of families who feel resilient after accessing services. But it's also about the qualitative impact. How much of an impact are you making to that individual person? So this is not the only way that we're getting stats, just so that you know. We're also getting data from you guys, not only in your annual reports, any kind of other data that you send to us, the stuff that you put in the dialogue boxes here, the community needs assessments, any visits that you have, all of that stuff, as well as the Military Family Panel through My Voice. All of that is being put together to provide a qualitative picture as well in terms of how are families doing, how are we making a difference, and how can we do better to help families become more resilient as the demographics are changing.
Just to build on what Gaynor's saying,
yeah.
We're currently one of the pilot sites for accreditation, and the requirements that we have in terms of outcomes and outcome measurement, and if that is something that is going to roll out possibly to other MFRCs,
yeah.
There really is a requirement for us to have the sharing and the ability to have that, because yeah. Why would we all be measuring separate outcomes or different outcomes or not rolling those up together? Like there's a disconnect. Yeah. And so I mean, we're feeling that when we're working through the accreditation process and talking about how we're doing outcome measurement, because like, you know, as Gaynor said, we're not all there, and we've been doing numbers for so many years, but yeah. In order to be accredited, numbers are not, that's not a base level acceptable to be accredited. So nationally, to be able to have, you know, those connections is going to be pretty critical.
Yeah, yeah, and that's something that we'll be looking at through the accreditation process. But another thing I wanted to say is also, in the effort to pare things down, we realized that many MFRCs are going far above and beyond what we're asking for here in terms of outcome assessment and that kind of thing. What we didn't want to do is we didn't want to oblige all MFRCs to do exactly what some of the other MFRCs are doing in terms of going above and beyond, just because they don't have the capacity to do so, or the population they're serving doesn't really lend itself well to getting those kinds of that kind of outcome data. So yeah, you'll notice that the information that we're asking for is very much pared down. This is the baseline, but as we move forward in the next few years, we'll be looking at other ways to gather this data, as well as outcome data at the local level. And but we just want to make sure that we're not in an effort to get as much info as possible and spread the word about what an impact all family services are making for families. We don't want to grind the system to a halt by obliging everyone to spend, you know, 3 out of their 7.5 hours a day collecting data. Gaynor, was there any other questions you had, or a follow-up question?
No, I just wanted to kind of, you know, as Kara said, I think it's important that that's where we're moving towards.
Yep.
And you know what, I personally don't think that it's additional hours in capacity. I think if we just kind of share best practices with folks and give them good tools, that they'll be able to do it, and it's not, it's just a matter of then becoming routine in your practice.
Yep, yeah, and that's a really good point, because that's one of the things that these video conferences are good for, actually, sharing best practices. So maybe what we need as we move along is, if that would be useful, I can put it out to people and see if it would be useful, is to have just a sharing best practices once every 3 or 4 months or something like that. A quick video conference where people share, okay, this is how we're gathering outcomes at the local level, and that will help other people to develop similar programs. Does that sound like something that might be of interest?
Jonathan, it's Nancy.
Yeah.
I'm just wondering, because I see that 4 of the 19 have used Webinex. If we're going to do a video one, maybe we could all get, you know, either we know how to use it or our computers are capable to do it first.
Sure. Yeah, for sure. Yeah. Okay. So I'll put that out there just to see whether or not it would be useful to have sort of a check-in once every quarter or so about best practices that you're discovering at the local level, or you may choose to just share those amongst yourselves with your various networks that you have, which is fine as well. Any other questions on the phone before we move to the WebEx participants here? Okay, I don't see any hands up on the WebEx. anyone who hasn't put their hand up that would like to ask a question, something not clear?
It's Nancy. I see Louise's hand up on my...
Yeah, Louise, did you have another question, or was your hand still up from before?
It's still up from before, so.
Okay. Okay, yeah. Thanks for picking up on that, Nancy. Yeah. Any other questions from anyone else?
I have a question from Trenton.
Okay.
We're just skipping ahead to staff hours dedicated to programming. The example that is given is employment counseling. Would that include our mental health and psychosocial and mental health counseling as well? Is that part of something that we need to be adding?
Sorry, could you ask the question again? I didn't catch the first part.
The number 0.7 or data collection 0.7, so staff hours dedicated to programming. It talks about program delivery and program planning and evaluation. And so this is a completely separate question than we were talking before. But the example talks about employment counseling. So would that be our mental health team's counseling as well? Like the hours we actually spend with counseling and doing
yeah, that's a good question. I see that I see mental health services as more of a separate thing. So I would probably take them out of that equation, just because programming tends to be more about deployment support, family separation, employment, education, those kinds of more programming aspects. Whereas counseling is more, is a little bit of a different animal. Does that make sense?
Yeah, and what about our psychoeducational groups that we run?
Yeah.
Would not be under, we wouldn't put our statistic underneath program planning, we'd put it somewhere else?
Right, you put it under psychoeducational, so that's why we split up the mental health services among the various different types of mental health services that are offered.
Okay, I think I just got caught up in the terminology there.
Okay, sure, yeah. Any other questions from the field? I don't think we've heard from, let's see, haven't heard from Calgary yet, I don't think. Did you have any questions, Heather? Okay. How about, okay, we heard from Petawawa. And Reagan wasn't able to join us today, so how about Sandra from St. John's? Did you have any questions coming up? Okay.
We must all be on mute.
Yeah, well, I'm not sure if everybody's just muted or I'm gonna unmute everyone, and that way, if people are talking, I'll be able to hear them, just in case you forgot to unmute your mic. Francine, did you have any questions?
Non, ça va.
Okay. Valcartier, est-ce que vous avez des questions?
Non, ça va, merci.
Okay. And Noah at Yellowknife?
No, I'm good, thank you.
Okay, and Teresa from Borden?
No.
Okay, excellent. Well, it sounds like there's a little bit of a chat going on the right-hand side there, but it sounds like everybody sort of got in the questions that they want. But don't make this the last time that, or don't feel like this the last time that you can ask questions about this kind of stuff. Just give me a call, send me an email. Like I said, I'm happy to have a teleconference with you and or any of your staff. We can even have a group teleconference if you find your staff are unclear about things or why we're asking for certain things or how performance measures came about, then I'm happy to join in on those teleconferences as well. All right, so we'll end it off here just to maintain, it looks like we're right on 2 o'clock, so right on an hour. And like I said, check out the website and just contact me if you have any other questions.
Okay, thanks.
Okay. Thanks,
Thank
folks.
you.
Thank you. Good weekend.
Yes. Jonathan?
Yeah?
Hi, Terry from Winnipeg.
Hi there.
And I just wanted to clarify the last question that you had around the tracking of staff hours dedicated to different activities.
Yeah.
So my understanding of your answer is that with respect to mental health services, you don't require those in that same way.
That's right.
But that you require them in the breakdown of like the number of hours served, number of hours direct service with clients.
That's right.
That is in the in the mental health stats?
Yeah, we're gathering them in a separate question. Yeah.
Okay. Great, thank you.
Okay, no problem.
Thanks a lot.
All right, have a great day.
You too. Bye.
Bye.